Let me ask you a question. Have you ever had jaw pain, headaches, clicking when you open your mouth, or a feeling that your bite just isn't quite right? Many people assume that's just part of stress or getting older, but often it's something called TMD, which stands for Temporomandibular disorder. Now that's a big name for something pretty simple. It refers to problems with the jaw joints. Everyone has two of these joints, one on the left and one on the right. They're called TMJs, or temporomandibular joints. And interestingly, they're actually the most complex joints in the human body. They're also the only joints that move together as a pair. You can't move the right one without the left one moving too. So even everyday things, talking, chewing, swallowing, require a surprising amount of coordination between muscles, tendons, ligaments, and the joint itself. Because the system is so complex, TMD can have many different causes, which means there are also many different treatments. One of the most common causes is grinding or clenching your teeth, sometimes called bruxism. A lot of people do this at night without realizing it. Over time, that constant pressure can overwork the muscles around the jaw and even damage the teeth. For many of those patients, we use something called occlusal splint therapy. It's a custom-made hard acrylic mouthpiece that fits precisely over your teeth. It protects the teeth from further damage and, just as importantly, allows the jaw muscles to finally relax. As those muscles relax, the bite can actually change slightly, so the splint needs to be adjusted over time. The initial phase of that therapy usually lasts about 3 months. Interestingly, during the pandemic, dentists everywhere saw a spike in grinding, jaw pain, and broken teeth. Stress has a very real impact on how your jaws function. But grinding isn't the only cause of TMD. Some people have bite misalignment, also called malocclusion, and they may benefit from orthodontic treatment. Others have had past injuries to the head or neck, and physical therapy can be very helpful in some cases. Patients benefit from working with a neurologist who specializes in facial pain. One of the things I explain to new TMD patients is that this condition behaves a lot like diabetes. It's something you manage over time rather than something that is completely cured. Our goal are two things: reduce pain and improve function. It's usually not realistic to promise zero pain or perfect function, but with the right treatment plan, most patients experience significant improvement. Now, I'll be honest with you, when I finished dental school, I didn't feel comfortable treating TMD. It's a complicated subject. That realization pushed me to continue studying it throughout my career. I trained at the Pankey Institute and the Dawson Academy, both known worldwide for advanced dental education. Dr. Peter Dawson actually wrote what many consider to be the definitive book on the topic: Evaluation, Diagnosis, and Treatment of Occlusal Problems. In 2015, I spent a week at the University of Kentucky studying with Dr. Jeff Okeson, one of the leading experts in oral facial pain. There were 60 dentists there from 6 different continents. And just last year, I completed additional training at Tufts University School of Dental Medicine, focusing on oral facial pain and sleep apnea. There's a strong connection between sleep apnea and TMD that we're continuing to learn more about. At this point in my career, I probably spent more money on continuing education about TMD than I did on dental school itself. And the more I learn, the more I realize how complex the topic truly is. It's a bit like peeling an onion. Every layer reveals another layer underneath, which means one important thing: even after all these years, I am still learning.